Turuki was started in 1995 by a group of midwives who started the service in Māngere. And as the organisation grew, we began to understand that health outcomes were not going to be achieved in the health sector alone, that we really needed to include a range of other issues to be dealt with, such as housing, employment, education, and also linking people with the services that they needed. So over a period of time, we looked at how we could actually deliver services closer to home. And now 90% of our services are delivered in the community. Our GP service has remained in Māngere, but we've, over the last couple of years, looked at opportunities for us to deliver health services differently. So we've been involved in the rheumatic fever program, and that's really allowed us to work in schools. And for the first time, we've really touched on being able to access whānau who are not accessing primary care. So that's been a very significant development for us. And of course, we're swabbing the throats of about 8,000 to 10,000 children a month. And so working with their whānau in the community is really important. Moving on from that, we've developed a partnership with a tertiary institution, and so now we're running nurse-led clinics on campus for young and mature students, mainly Māori and Pacific. And we've also just received a contract this year to run GP services in the Auckland South Correctional Facility and take our pharmacy with us. This has led us to be thinking more about how we work collaboratively with other organisations already working in this space to deliver better health outcomes for those who have been incarcerated and for their loved ones who come into South Auckland. So Closer to Home is about bringing services into the community, about being responsive to whānau needs, and to really work with whānau to understand the issues that they're grappling with and how to deliver them in a more responsive way. I also want to mention with the health strategy that workforce development is an ongoing importance for bringing services to be more culturally competent and more responsive, more whānau-centric. I'm very excited about the New Zealand health strategy and the direction of travel that we're on. I think it's important that the strategy as a policy framework will encourage innovative spaces for whānau and providers and the sector to work in, to ensure that we understand what success looks like to them, what well-being looks like to them. It's important that the strategy supports collaborative working together, to using resources, wisdom, collective support to encourage better outcomes. So through the strategy, the new New Zealand health strategy, my hope is that whānau will be able to aspire, to dream, to fly, to thrive, to prosper, to live well and stay well in their community of choice. Mauri ora.